Thank you, Chairman. I just see a great opportunity this morning. I really do. The stars are aligned. We share so many of the same motivations. We all recognize the challenges, that the cost of health care is a major challenge for Americans. I think most of us recognize that the ACA empowered insurance companies. We're sending $150 billion a year to insurance companies, and one of our solutions is to take part of that money and add it to an HSA where patients get to make their own choices. If we give patients choices, we turn them into consumers again. And they're great shoppers. Americans are great shoppers if you give them the opportunity to look at price tags. Senator Sanders mentioned that a Medicare for all, according to the CBO, would save $650 billion a year. I think putting it in proportion, we're spending $5 trillion a year right now on health care. Our price tags bill would save Americans $1 trillion a year. That's according to 40 economists, and these economists are from the West Coast, the East Coast, the Midwest. I saw even some people from the Southeast Conference have economists too. I didn't know that. But so we think that the transparency part of this, the price tags part of this is just so important to go along with giving expanded HSAs. Mr. Chairman, I'd like to ask unanimous consent to enter 4 documents into the record. The first is the letter of support from 40 economists pointing out ways price transparency will lower the cost of health care. The second, a letter of support from the National Associations of Benefits Insurance Professionals. The third is a letter of support from 54 employer groups and unions highlighting the importance of passing patients deserve price tags, which Senator Hickenlooper is my co-sponsor on that bill. We have 8 senators sponsoring it. 4, it is bipartisan. 4, I believe, are on this committee. The fourth is a report from the Patients' Rights Advocate showing how price transparency can reduce healthcare costs by more than $1 trillion annually.
Without objection.
Thank you. Mr. Chairman, again, it's time for this isn't a single or double. I think that this is a home run bill. And I would just like to ask your feelings on giving us some type of a markup on it, hopefully sometime this year.
Absolutely. And by the way, Senator Baldwin also echoed that sentiment. So again, there is bipartisan consensus on the need for transparency.
I think that whatever we agree upon, let's get it done. And I think that probably 80% of some of the solutions we agree upon. So let's move. The American people need it, and they deserve that as well. I'll ask Mr. White, what do you feel like the impacts of price tags for consumers would do?
It would be a game changer. I think that right now we have an opaque system where people don't even know what they're buying until after they bought it, after they get the bill from the company, after they get the care from the doctor. And so having that upfront price disclosure, absolutely foundational, critical to getting better market results, lower costs. In specific markets, like within one zip code, the price of an MRI can vary by up to 7 times. 7 times. So $500 at one imaging facility, $2,500 at another imaging facility, and the consumer may not even know that they're getting a bad deal. Disclosing that up front can absolutely encourage shopping, can lower costs.
Especially if you know that the outcomes are better at the less expensive place. I think hip surgery is another great example. You might have a hip replacement in a surgical center that gets reimbursed $10,000, and in some other hospital it's $50,000 as well. Ms. Strauss, let's talk about consumers again. I'm sure you know that women make 80% of the healthcare decisions for families. So when I was running a hospital, we would market towards women as well. By giving shoppers price tags and expanding their HSAs, whether it's for direct primary care or for these preventive medicines, how do you think it impact the real spend, not just the government subsidies, but the real spend of health care?
Yeah, I think it would have a tremendous impact. And I think what other place in our world do we buy something without not having any idea what the actual cost is? And so we do need to make sure that transparency is a big part of that. But I do think having accounts where people can be in their own driver's seat of their own healthcare is essential. It also makes them more accountable for the choices that they're making. So when they're spending the money and they know exactly where it's going, they're going to be a little bit more thoughtful about that. And again, on the preventive, we can give free preventive all day long, but if somebody doesn't take advantage of it, they're not getting the service. So direct primary care is a huge benefit.
And I got a lot more things I'd like to talk about, but I think there's great opportunities with expanding healthcare plans across state lines through association healthcare plans. If Amazon or Costco was able to offer their members some type of an association healthcare plan, it would help those small businesses as well. And want to just briefly circle back to the importance of community health centers. It's the closest thing to Medicare for All that I can think of is expanding these community health centers, which is going to take funding as well, and making America truly healthy again, a more holistic approach. Thank you, Mr. Chairman.